But the top story this evening, today, ladies and gentlemen, is Children's Day. And as the nation celebrates, a new report by the Indian Council for Medical Research lays bare the ugly reality of malnutrition in India and how it contributes to chronic diseases. Now, just sample this. 15% of India's disease burden is simply due to the lack of nutritious food for children. This is 12 times higher than China. What's even more shocking is that even Kerala, which is India's best performing state in combating malnutrition, fares worse than its neighbour Sri Lanka. Archana Shukla has been going through this report. It's a very, very detailed report. She joins us now with a hard reality check. Archana, unfortunately, on Children's Day, this is the uncomfortable, sad truth.
Well, yes, and certainly our children in India are not quite healthy, and this is despite years of intervention on child nutrition through various schemes like that of ICDS. Malnutrition continues to be the single largest risk factor leading to health loss in India. Though it has improved since 1990, it is still responsible for 15% of the disease burden. And like you pointed out, as compared to India's peers, the disease burden is 12 times higher than that of China. So while Bihar, Rajasthan and Uttar Pradesh were the worst performers as far as child and maternal malnutrition is concerned, and you look at the numbers, the data, there is a wide variation if you look at the best performing states, which are that of Kerala, Goa and Manipur. But even in Kerala, the disease burden due to malnutrition at this good rate is 1.7 times that of Sri Lanka. Now look at how the risk factors over the last 26 years have changed. If you look at whole of India, malnutrition continues to be the top risk factor. Air pollution, look at this one, it has gone up to be the second biggest risk factor. And you know, while we keep talking of Delhi, states like Uttar Pradesh, Haryana, Bihar, Rajasthan are the worst affected. Dietary risks, high blood pressure, hypertension and diabetes are becoming the leading health risks, indicating how disease burdens are shifting to non-communicable diseases. The next data set on our screens will be to show that how the burden is now 55% due to non-communicable diseases in 2016. And look at how communicable disease burden has come down to about 32.7%, 12% relates to injuries. This transition from communicable diseases to chronic diseases like that of hypertension and diabetes is varying with a varying rate across all states. So states like Kerala have seen this transition faster, which means they have a larger burden of non-communicable diseases, but those that of Bihar, Rajasthan, UP are still dealing with the double burden of disease, both infectious as well as non-communicable diseases, and this is where also children bear the biggest brunt of infectious diseases. Looking at the wide variation among states, the need of the hour right now is to have state-specific strategies even in the ambit of the centre's national health policy. Back to you.
Archana Shukla, thanks very much for capturing the sad truth and for giving us some indication of what the road ahead should look like. But joining us now to discuss that further, Vinod Paul, member of the Niti Aayog, Soumya Vishwanathan, DG of the Indian Council of Medical Research and the Deputy DG Programs at the World Health Organization. We'll also be joined in a short while by Srinath Reddy. Soumya Vishwanathan, if I can start by asking you, what seems to be going wrong here? I mean, is it an issue of money? Is it an issue of not feeding our children right? What is the problem exactly? Because if one were to look at the Integrated Child Development or the ICDS scheme, you know, significant sums of money have been spent on that. Where are we going wrong? We're not even comparable to our neighbors like Sri Lanka, 12 times worse than China.
So, yes, thank you, for discussing this report, because I think it's an important first step for us and particularly for the states to really look at disaggregated disease burden and for each state to try and analyze what their important, not only the diseases are, but what the risk factors are so that they can actually target their interventions. Now, yes, it is a bit shocking that after all these years, malnutrition, especially among women and children, still comes out as the biggest risk factor for a lot of our disease burden. But we have made a fair amount of progress. So from 1990 to 2016, in the past 25 years, the disease burden due to malnutrition definitely has come down from, this It caused 35% at that point, and now it's down to 16%. So there is progress being made. We need to accelerate that progress. And at the same time, the combination of risk factors which cause the non-communicable diseases like the physical inactivity, the dietary risks, the kind of unhealthy food that we're eating, and combined with high blood pressure, blood sugar, are actually leading to a lot more non-communicable diseases. So I think nutrition as a whole is important, whether it's undernutrition or in some segments now of our population, overnutrition.
Okay, those are the problems that we need to address. Let me go across to you, Vinod Paul at Niti Aayog. Mr. Paul, as we can see, there are huge differences and inconsistencies between how various states are performing. Now, the Niti Aayog has decided to put together an index which tells us how states rank on the parameter of healthcare. Is that going to work? Is the healthcare ranking going to work to force states that are at the bottom of the heap, states like Bihar, etc., to do better? Or does the center now need to take an even greater responsibility when it comes to funding, when it comes to designing state-specific schemes, for instance, in coordination and collaboration with states? I understand health is a state subject, but what is the answer to ensure that we see more consistency across different states?
Improving health and nutrition of the country is a joint and a collective endeavor, both of the state governments and the union government. The health and nutrition both being as a state subject, there is a clear responsibility for the state, but also as a union government, it has the responsibility of setting the broad policy parameters and also to contribute toward the resources. The index that you have talked about brings out the status of various states in terms of their progress and performance, and that is in the spirit of competitive federalism, from where the different states get a trigger for excelling and serving the people ever better. You are absolutely right that yes, there is a need for increased resources for us to accelerate our progress for health as well as for nutrition. And again, that is a collective responsibility because the government health spending overall, 2/3 of this comes from the state governments and 1/3 currently comes from the union government. So if you have to raise
if
the
I could
resources,
ask about that specific suggestion,
it is a joint responsibility,
Mr. Paul,
and that's how it should be.
No, it is a joint responsibility. No, you're absolutely right, sir. But if I want to ask you specifically about what that would actually entail, I'm looking at a Niti Aayog action plan. It says that states should increase the health expenditure to 8% and center should raise it to 2.5% by 2025. Every budget, sir, we have the same conversation. When are we likely to actually move forward on spending this kind of money?
Well, I think you can see the commitment of the government as enshrined in the National Health Policy to raise the government spending on health, raising it to 2.5% of the GDP, which is almost doubling it in the next 5 to 8 to 10 years. At the same time, we expect that now that the states have a greater allocation from the 14th Finance Commission recommendations from the central tax allocations, states also have a responsibility to raise the allocation to health sector as such. It's a collective endeavor. Both the state and the central government have to work together. And I do hope that in the budget that we will see next year, both the union government as well as the state governments will do their part. And we are creating a blueprint of how the additional money should be spent on priority areas. And one of the priority areas is truly more investment for primary health care. The government's policy, national health policy, envisages spending 2/3 of our resources on primary health care because the epidemic or the burden of disease coming from the non-communicable diseases, which Dr. Swaminathan referred to and your anchor referred to, can only be taken care of by preventing these disorders and by detecting them early. And that is the business that we carry out at the primary healthcare level. The secondary prevention and tertiary level care comes much later. So the whole, this report actually in a way, reconfirms the notion that India's future health system must have a very strong primary health care, which is efficient, which is out there performing its function, both health promotion and care in terms of ambulatory care, but also matched with resources that must go to this new vision, comprehensive primary health care that the nation is committed to.
Yeah. K. Srinath Reddy, President of the PHFI, also with us. Mr. Reddy, we're talking about the new risks. Air pollution, one of the new risks. Dietary risks. We're seeing the disease burden shifting towards non-communicable diseases. If you look at the national health policy, it talks about eradication of Kala Azar, tuberculosis, etc. What is the kind of intervention that will be required now to address these new risks that have emerged on the healthcare front as far as our children go, sir?
Well, we require interventions at 3 levels. One is at the level of policy, one is at the level of the health system, and one is at the level of community empowerment. At the level of policy, we need interventions like tobacco control through increased taxes on tobacco, and of course other strong measures like effective implementation of the ban on smoking in public places and advertising, but also controlling unhealthy foods in terms of marketing, raising the prices of unhealthy foods and subsidizing the prices of healthy foods and healthy edible oils. So that requires a certain amount of policy intervention, and of course the whole area of urban design and transport influences pollution, as do other measures, particularly related to agricultural waste disposal and energy security for controlling indoor air pollution. So those are all policy measures. At the level of the health system, I completely agree with Professor Vinod Paul that a comprehensive primary health care, both in rural and urban areas, can greatly strengthen early detection and cost-effective care of risk factors that lead to cardiovascular disease and early control of diabetes as well before complications occur. And of course, health promotion and disease prevention are broad components of primary health care as well. But at the level of the community, you require community empowerment.
On the issue of primary health care, and I'll get Mr. Paul to react to that as well, because it was a suggestion from the Niti Aayog. Is privatization the answer? Is it one of the solutions, Mr. Reddy?
Well, I don't think the Niti Aayog really talked about privatization of primary health care. Certainly, the public sector services need to be strengthened.
Well, they talked about privatizing district hospitals.
Yes, that is secondary care.
No,
but even in primary care, even in primary care, hypertension and diabetes are frequently treated by private practitioners.
Sure.
So we need to ensure that they are appropriately providing the treatment, and therefore both public sector, which is strengthened and playing the primary role, as well as supportive role played by the voluntary and private sectors, all of these are complementary.
Okay. Sorry, Mr. Paul, go ahead. Privatizing district hospitals, the role of the private sector to ensure that our healthcare goals are achieved, that we actually do better than the current numbers that are on our screens, sir.
Well, firstly, appreciate the fact that primary health care provision is primarily the business of the government, the state and the central government. Primary care that's available to the rural poor or urban poor is often untrained and so on. So the real primary care, which will stem the problems of the day, has to be built by the nation. Currently, we are addressing only 15% of the agenda of primary health care, which is primarily maternal child health and disease control to the extent of a few diseases like malaria and so on. So appreciate the fact that primary health care, we still have a long way to go, and the nation's commitment expressed through the national health policy recognizes this, and we are committing huge resources that we will put on the table on primary health care. In terms of private sector involvement for district hospital, this is only a small part of an overall strategy, where a strategic purchase is envisaged. Wherever the public health services are not available or not optimum, in order to serve the people of India and the citizens of that region, there is a provision for strategic purchase, and in that rubric, you know, there is a mechanism being offered that state governments can engage the private sector in providing services which are tough services like dialysis services, for example, or heart-related services. The angiograph is to be made available at the district level through private sector engagement, through an agreed mechanism in which there is a responsibility and there's an accountability. But this is, you know, one part of the story. But I think the big message from the report today is that India has undergone a shift toward chronic diseases in a very big way. It has happened in all the states. So in addition to addressing the communicable disease and maternal child health agenda, we have to really put resources and the best thinking that we can for the non-communicable diseases,
on the non-communicable side,
and for secondary prevention, primary prevention and secondary prevention. And primary care is the way forward to make a difference.
Okay. Ms. Swaminathan, we're now going to have to focus our attention not just on communicable but also on the non-communicable diseases. And very quickly, let me ask you, ma'am, what is the urgent intervention required to ensure that the gaps that we're seeing between the centre and states does also narrow?
Yes. Well, you know, as was mentioned previously, the healthcare delivery really is the responsibility of state governments, while the central government certainly is involved in formulating policies, setting directions, targets, monitoring, and working with state governments partially to support in terms of resources, but also I think in terms of innovations. And I think we must also now look at a lot of healthcare innovations that are occurring. Different state governments are experimenting. The ICMR has been working with a number of state governments to implement a policy for control of high blood pressure, hypertension at the community level, which is one of really our major risk factors causing chronic disease and especially kidney disease and so on. So each state is really thinking of a different model of being able to deliver care at the community level. So I think there's a lot of learning in the years to come. There's a lot of models that could easily and best practices that we could adapt from both states as well as from countries, even our neighboring countries that have done well. But I think people's health literacy needs to improve. I think the knowledge of an average person about health risks, how to protect oneself, and including diet, I think that's very important. And unless we get communities involved,
that is the need of the hour.
Yes.
Yes. Well, unfortunately, we've run out of time. We would like to continue with this conversation, but Vinod Paul, member of the Niti Aayog, K. Srinath Reddy, president of the PHFI, and Soumya Swaminathan, director general of the ICMR, thanks very much for joining us to talk about what is an uncomfortable truth in India, but hopefully we will make progress on some of the solutions that have been put forward on the program. Thanks very much for your time and for joining us here. But let's